Hello, my name is Trina Rose Cerezo Fox, and today I'll be performing the skill video of prenatal education precautions. I'll do a room scan. And then here's the ceiling. Okay, so my name is Trina Rose Cerezo Fox, and I will start by entering the room, closing the door for patient privacy and hand hygiene. I'll introduce myself to the patient and proceed with the education. First, we will be discussing foods to avoid. First, you're going to want to avoid raw meat, raw egg, and shellfish, as this can be contaminated with salmonella. Next, you'll want to also avoid deli meat, soft cheeses, unpasteurized dairy, and smoked seafood, as this can be contaminated with listeria. And you'll also want to avoid fish with high levels of mercury. Next, we'll go on to the next category, and that's going to be medications and supplements. Medications that are over the counter that you can take are going to be paracetamol and budesonide. Medications that you'll want to avoid are NSAIDs, loperamide, phenylephrine, and oral decongestants. A supplement that you should take is going to be a prenatal vitamin. You want to make sure it contains, and if it doesn't contain, then get them also. It's going to be folic acid, iron, vitamin A, calcium, vitamin B12. And you'll want to avoid taking any herbal or dietary supplements, as these can be harmful to you or the baby, since we don't know if they're not federally regulated or tested. Next category is going to be environmental exposures to avoid. First, we'll talk about cigarette smoke. This can lead to an increased risk of low birth weight, stillbirth, preterm birth, and SIDS. Second one is going to be lead, and that can lead to interruption in fetal brain and nervous system development. And the third one is going to be pesticides. This can lead to birth defects and also interfere with fetal brain development. Next category is going to be tobacco, alcohol, and substance use. You'll want to avoid it because some of the things it can cause for the mother is going to be liver damage, cardiovascular disease, mental health disease or disorders, and increased risk of HIV. And then the potential issues it can cause for the fetus are going to be stillbirth, low birth weight, stillbirth, SIDS, FASD. They can be born addicted, and they can also go through withdrawals. Next category we'll discuss is travel. The best time to travel is going to be in your second trimester. You can best prepare for this by making sure you have good walking shoes, stay hydrated, have a copy of your medical records with you, and make sure you're up to date with your vaccinations, including flu and RSV. You will want to avoid places that have areas that have Zika virus and malaria, as well as places that have unsafe food and water practices. You will want to avoid travel if you have a health history of severe anemia, preterm labor, gestational hypertension, or uncontrolled diabetes. A complication of prolonged periods of sitting that can occur because of the disruption of blood flow to the legs. Could be a severe leg edema as well as DVT. These complications can be avoided if you stay hydrated, make sure you take frequent breaks, and stand and walk every 2 hours. And lastly, we'll go over dental visits. The best time to have a dental appointment is going to be between 14 to 20 weeks. And it is okay to have x-rays done, as well as routine and urgent dental care procedures. And lastly, regarding dental care, a common dental disease to watch out for is going to be gingivitis. Thank you.